After you deal with any first aid emergency, but particularly after CPR or serious trauma, you'll experience some form of emotional response. The whole episode can leave you feeling overwhelmed, and it can cause you to doubt what you did was the right thing, or doubt what the outcome might have been if you'd have dealt with the situation differently. Post-traumatic stress disorder, or PTSD, will affect different people in different ways, and this can last for a few hours or days, and sometimes even for months or years after the event. Common ways that it can affect people include flashbacks, nightmares, panic attacks, depression, fear, stress, short-temperedness, and the person may have a change in personality. They may also change the way they act, avoiding situations that remind them of the incident. There are some general guidance on post-traumatic stress disorder given by the Royal College of Psychiatrists. We've put a link on the Pro Training's dashboard where you can find out more information. Some of the ways they recommend you can help yourself or help someone else include try and talk over what happened with a friend, a doctor, family, or someone at work. Talking may help you to put things into perspective. Try to keep to your life patterns as much as possible and avoid letting the problem take over your life. Go back to the area where it happened and talk to others if possible and discuss what's happened on that day. Take care when getting out and about, especially if you're driving, as your concentration may be affected or distracted. Relaxation exercises and exercises in general can help, and if it gets too much for you, talk to a medical professional. When you deal with any medical emergency, you can only do your best. It's not possible to change things after the event. The important thing is you helped that person. All anyone can ask is you do your best. Feel good that you got involved to help that person, as many people simply couldn't have been bothered.